Now, head of the WHO, Dr. Tedros Adhanom Ghebreyesus, wants countries around the world to put in place some strong measures to avert any further spread of the disease.
It's now more than a month since the last case of Ebola in DRC. If it stays that way, the outbreak will be declared over in less than a month's time. We would like to thank all our partners for their solidarity in staying the course in the service of the people of DRC, and my special appreciation especially to the government and people of the Democratic Republic of Congo. That same spirit of solidarity must be at the center of our efforts to defeat COVID-19. More than 200,000 cases of COVID-19 have been reported to WHO, and more than 8,000 people have lost their lives. And more than 80% of all cases are from two regions, the Western Pacific and Europe. We know that many countries now face escalating epidemics and are feeling overwhelmed. We hear you. We know the tremendous difficulties you face and the enormous burden you're under. We understand the heart-wrenching choices you're having to make. We understand that different countries and communities are in different situations with different levels of transmission. Every day, WHO is talking to ministers of health, heads of states, health workers, hospital managers, industry leaders, CEOs, and more to help them prepare and prioritize according to their specific situation. Don't assume your community won't be affected. Prepare as if it will be. Don't assume you won't be infected. Prepare as if you will be. But there is hope. There are many things that all countries can do. Physical distancing measures like canceling sporting events, concerts, and other large gatherings can help to slow transmission of the virus. They can reduce the burden on the health system, and they can help to make epidemics manageable, allowing targeted and focused measures. But to suppress and control the epidemics, countries must isolate, test, treat, and trace. If they don't, transmission chains can continue at a low level, then resurge once physical distancing measures are lifted. WHO continues to recommend that isolating, testing, and treating every suspected case and tracing every contact must be the backbone of the response in every country. This is the best hope of preventing widespread community transmission. Most countries with sporadic cases or clusters of cases are still in the position to do this. Many countries are listening to our call and finding solutions to increase their ability to implement the full package of measures that have turned the tide in several countries. But we know that some countries are experiencing intense epidemics with extensive community transmission. We understand the effort required to suppress transmission in these situations, but it can be done.